Hi, my name is Vanessa. I am a clinical resource nurse at Iowa Specialty Hospital. And today I'm going to be teaching you how to put on and take off your personal protective equipment so that you may visit your loved one while they are here. We make sure that we teach people how to do this properly so that we protect not only you, but we also better protect other patients and the hospital staff. So please follow along as we go through this step by step. So when you come up to see your loved one, you will come up and see a PPE cart. It's specifically made for the visitors. The first thing that you're going to want to do is you are going to want to use the hand sanitizer that is provided on that cart. Make sure you get it rubbed in very good. Check getting your hands through the fingers and everything. We're also going to make sure that we let it dry appropriately, and that's the way we know that it's going to be most effective. Then we are going to find a gown. So we have gowns provided. You are going to put on the gown over your clothing, pulling it up over your head and making sure that you're covering your body. And you're going to tie our gowns wherever there is a tie or a snap provided. Some gowns will not look like this one, but we will have gowns available for you. The next thing that we are going to do is we are actually going to replace your cloth or personal home mask with a mask that's provided at the hospital. So we're going to take off this mask. You can put it in your pocket or wherever you find wherever you see fit. We could put it on a paper towel outside of the room, and we will grab one of the hospital provided masks and we will put that on. After we have that on, we are going to put on a shield. This shield will also be provided. It is a one-time use shield. It will just sit on your forehead and wrap around the back of your head like so. We will be there to help you with every step of this, but this is just giving you the preliminary. The last thing you're going to do is you're going to put on a set of gloves. Again, we are taking every precaution to protect you, to protect the rest of the hospital in this day and age with COVID. Put on these gloves, and then once you have these gloves on, then you will be able to walk into the patient's room. We're trying to get the cuffs over the edge of our gown here. Just making sure that we're tucked in good there as much as we can. Once we have put on all of our personal protective equipment, we are ready to walk into the room. So now we are done visiting our loved one or our friend, and we are ready to leave the room. This is very, very important that we follow these steps in the precise order so that we make sure that we are protecting ourselves as fully as we can. There will be a bin with a red bag in it next to the doorway. So what I want you to do is I want you to open the bin, and without touching your face, grab your shield and just pull it off and throw it in the bin. The next move you're going to do is kind of a Hulk move. You're actually going to grab your paper gown, you're going to break it at the shoulders and pull it away from you. Making sure only to touch the outside of the gown, and you are going to pull it away from you, and you are going to pull your gloves off with it, and you're going to throw it in that bin. When you are done doing that, you are going to hand sanitize, which will be available for you right next to the door. And then you are able to open the door. Once we are outside the door, we are going to take off the mask that we were wearing in the room by grabbing the strings. We are going to throw it away in the receptacle available, and then you may put on the mask that you came in with originally. After we get this all accomplished, we are going to go straight to the sink and wash our hands, which should be available right across the hallway. If you should have any questions while doing this, or any questions at any time, please make sure you reach out to one of the staff members. They'll be able to assist you. Thank you.